what are some therapies that you do to help these patients?
So we try with ALS patients to really focus on how we're going to provide better adaptive equipment for them, better family training, since we know that this is something that will continue to progress.
I want to bring in the
worse.
graphic because you're speaking about this, Saranee, and I think it ties into what you're saying. These are patients with ALS are you often see muscle cramps, tight and stiff muscles. So something as a physical therapy might help a little bit with that, correct?
Correct. So usually we'll see patients start to experience symptoms kind of from the more distal, kind of I guess thinking of it from the outside in. So from the more distal areas of the body. So starting with like the hands and fingers, the feet, and then kind of moves up progressively toward the center of the body. So some of the symptoms can be muscle twitches in the arm, leg, shoulder, and tongue, muscle cramps, tightness and stiffness in the muscles, muscle weakness affecting an arm, a leg, or the neck, slurred and nasal speech, or difficulty chewing or swallowing.
Absolutely. Now, I know you brought some tools that you use to help patients, and we'd love to see that and what it is that they do and how they help the patient in their mobility and skills.
Yeah, so I brought some of our smaller kind of adaptive equipment. So when someone is going to have a condition that will last for some period of time, we want to make sure that they have some tools that will help them perform easy daily activities. So for example, this is something that we'll use that you hook through the button hole and you put the button inside and you can pull the button through. So for someone who's not able to do that fine motor grasp, this is very helpful.
With those fine motor skills, right?
This is something that we have adapted so that if someone doesn't have great grasp, they can still hold a fork to feed themselves. And kind of keep that independence with something like eating.
It's those basic needs that you don't think about. We take for granted.
We take that completely for granted. Yes, we do it so automatically. But just small things that will help. The same thing with one of these that's like a weighted utensil. It helps so that if you don't have as much fine control, this makes it a lot easier. It's a bigger grasp. And then we have something like this. This is a sock aid. So this is something that maybe a family member can leave a sock on at night, and then in the morning the patient can just grab it and kind of slip it through their foot, and you just pull through and you have the sock on.